Do you agree with me that the United States should join every other major country on earth and guarantee health care to all people as a human right? Yes? No?
Senator, I can't give you a yes or no answer to that question.
Health care a human right? Is health care a human right?
In the way that free speech is a human right,
Yeah.
I would say it's different because if with free speech doesn't cost anybody anything, but in healthcare, if you smoke cigarettes for 20 years and you get cancer, you are now taking from the pool.
Well,
and so are you guaranteed the same right, or is there also a duty?
I'm sorry. Will you support legislation that I will introduce which says that in America we should not be paying a nickel more for prescription drugs than people around the rest of the world? Yes, no?
To equalize it?
Not to equalize it, that we should not be paying more than other countries for the same damn drug.
President Trump has asked me, in fact, I had a meeting with President Trump a week ago where we showed him the charts.
He knows the charts.
We're paying 10 times more from Europe.
That's right. And are you going to commit to us that you will end that absurdity?
I think in principle we can. We should end that disparity.
Good. Okay.
My journey into the issue of health began with my career as an environmental attorney, working with hunters and fishermen and mothers in the small town in the Hudson Valley and along the Hudson River. I learned very early on that human health and environmental injuries are intertwined. The same chemicals that kill fish make people sick also. Today, Americans' overall health is in grievous condition. Over 70% of adults and a third of children are overweight or obese. Diabetes is 10 times more prevalent than it was during the 1960s. Cancer among young people is rising by 1 or 2% a year. Autoimmune diseases, neurodevelopmental disorders, Alzheimer's, asthma, ADHD, depression, addiction, and a host of other physical and mental health conditions are all on the rise, some of them exponentially. The CDC says 90% of healthcare spending goes toward managing chronic disease, which hits lower-income Americans the hardest. The president's pledge is not to make some Americans healthy again, but to make all of our people healthy again. There is no single culprit in chronic disease. Much as I have criticized certain industries and agencies, President Trump and I understand that most of their scientists and experts genuinely care about American health. Therefore, we will bring together all stakeholders in pursuit of this unifying goal. Before I conclude, I want to make sure the committee is clear about a few things. News reports have claimed that I am anti-vaccine or anti-industry. I am neither. I am pro-safety.
We'll have order. Please proceed, Mr. Kennedy.
I am pro-safety. I worked for years to raise awareness about the mercury and toxic chemicals in fish, and nobody called me anti-fish. And I believe that that vaccines play a critical role in healthcare. All of my kids are vaccinated. I've written many books on vaccines. My first book in 2014, the first line of it is, I am not anti-vaccine, and the last line is, I am not anti-vaccine. In my advocacy, I've often disturbed the status quo by asking uncomfortable questions. Well, I'm not going to apologize for that. We have massive health problems in this country that we must face honestly. And the first thing I've done every morning for the past 20 years is to get on my knees and pray to God that he would put me in a position to end the chronic disease epidemic and to help America's children. We shouldn't be giving 60% of the kids in school processed food that is making them sick. we shouldn't be spending 10% of the SNAP program on sugar drinks. So we have a direct ability to change things there. We also, in Medicaid and Medicare, we need to focus more on outcome-based medicine, on putting people in charge of their own health care, of making them accountable for their own health care so they understand the relationship between eating and getting sick. Most importantly, we need to deploy NIH and FDA to doing the research to understand the relationship between these different food additives and chronic disease so that Americans understand it and make sure that Americans are aware. But I don't want to take food away from anybody. If you like a cheeseburger, a McDonald's cheeseburger, or a Diet Coke, which my boss loves, and you should be able to get them.
Did you say that COVID-19 was a genetically engineered bioweapon that targets black and white people, but spared Ashkenazi Jews and Chinese people?
I didn't say it was deliberately targeted. I just quoted an NIH-funded and NIH published study.
Did you say that it targets black and white people, but spared Ashkenazi Jews?
I quoted a study, Your Honor. I quoted an NIH study that showed that
I'll take that as a yes.
races
I have to move on, I have to move on. Did you say that Lyme disease is highly likely a materially engineered bioweapon? I made sure I put in the highly likely. Did you say Lyme disease is a highly likely militarily engineered bioweapon?
I probably did say that.
Did you say that?
And that's what the developer of Lyme
I want all
disease
of our
said.
colleagues to hear it, Mr. Kennedy. I want them to hear it. You said yes. Did you say that exposure to pesticides causes children to become transgender?
No, I never said that.
Okay, I have the record that I'll give to the chairman, and he can make his judgment about what you said. Did you write in your book, and it's undeniable, that African AIDS is an entirely different disease from Western AIDS? Yes or no, Mr. Kennedy?
I'm not sure if I made that.
Okay, I'll give it to the chairman, Mr. Kennedy. And my final question, did you say on a podcast, and I quote, "I wouldn't leave abortion, to the states. My belief is we should leave it to the woman. We shouldn't have the government involved, even if it's full term." Did you say that, Mr. Kennedy?
Senator, I believe that every abortion is a tragedy.
Did you say it, Mr. Kennedy? This
believe
matters. It doesn't matter what you come here and say that isn't true, that's not reflective of what you really believe, that you haven't said over decade after decade after decade, because unlike other jobs we're confirming around this place, this is a job where it is life and death for the kids that I used to work for in the Denver public schools and for families all over this country that are suffering from living in the richest country of the world that can't deliver basic health care and basic mental health care to them. It's too important for the games that you're playing, Mr. Kennedy. And I hope my colleagues will say to the president, I have no influence over him. I hope my colleagues will say to the president, out of 330 million Americans, we can do better than this.
Thank you. We need to move on.
Americans don't, by and large, do not like the Affordable Care Act. People are on it. They don't like Medicaid. They like Medicare. And they like private insurance. We need to listen to what they would prefer to be on private insurance. Most Americans, if they can afford to be, will be on private insurance. We need to figure out ways to improve care, particularly for elderly, for veterans, for the poor in this country. And Medicaid, the current model is not doing that. I would ask, any of the Democrats who are chuckling just now, do you think all that money, the $900 billion that we're sending to Medicaid every year, has made Americans healthy? Do we think it's working for anybody? Are the premiums low enough? Now, I'm saying that the Trump administration
You don't know if you raised a lot of money.
The Trump administration has made clear that it does not want to freeze benefits for any Americans under Medicaid or Medicare, and I do not want to dismantle Medicaid.
The freeze is affecting beyond Medicare and Social Security. I would hope you would have known that to be able to answer some of this. Now, you've said publicly, you want to immediately get rid of 600 NIH workers on job one, on day one. When we had our meeting, you said you'd actually like to get rid of 2,200 people from HHS. Which offices are you going to start cutting and riffing these 2,200 workers from?
Senator, there's 200 political appointees that are changed during every administration.
So if you got rid of those 200 political appointees, you're not going to replace them with your political appointeys?
Well, President Biden this year changed 3,000 employees at HHS. 3,750
So
at NIH.
your 2,200, what departments are you going to pick them from?
Well, the same as President Biden did when he changed 3,000 out. They're from all across all
I'm down to a minute.
departments.
But if you are in this position, will you pledge that you will not fire federal employees who work on food safety, work on trying to preventing things like salmonella?
Senator, there are 91,000 employees.
So that I take that as
HHS.
that's a simple yes, and I'm going
You
to take
think
that as
I
a
could
no.
run that
I
agency
take that
without
as a
getting rid
no.
of some-
Will you actually? We talked about protecting Americans from cyber criminals, something we need to do a lot more on. Will you commit not to fire anyone in the health arena who currently works on protecting Americans from cyber attacks in their healthcare files?
I will commit to not firing anybody who's doing their job.
Based on your opinion, based upon your opinion, or your political agenda, or Mr. Trump's political agenda?
Based upon my opinion.
How are you going to handle Title X on that? I saw how President Biden handled that in the punitive measures that came on my state for those that are in rural health care. How are you going to handle Title X?
I'm going to support President Trump's policies on Title X. I agree with President Trump that every abortion is a tragedy. I agree with him that we cannot be a moral nation if we have 1.2 million abortions a year. I agree with him that the states should control abortion. President Trump has told me that he wants to end late-term abortions, and he wants to protect conscience exemptions, and that he wants to end federal funding for abortions here or abroad. That's Title X. I serve at the pleasure of the president. I'm going to implement his policies.
Things that Javier Becerra did immediately when he came into HHS was conscience protections for medical professionals that were being compelled against their conscience to perform medical procedures that violated their conscience. Javier Becerra stepped in immediately into HHS and withdrew that and said, no, the federal government will tell you what you believe about these issues. You don't have conscience protections anymore, and refuse to protect those folks. Will you step in and say that healthcare individuals have the right of conscience again, as the federal law allows?
Yeah, I mean, the first thing that occurs to me when you ask that question is what patient would want somebody doing a surgery on them that, believes that the surgery is against their conscience being forced to perform that. I don't know anybody who would want to have a doctor performing a surgery that the doctor is morally opposed to. Listen, I came from a family that was split on life and choice. I have cousins today who believe that abortion at any stage is equivalent to homicide. Now, there are other people who believe the opposite. But the good thing in my family that I really loved is that we were able to have those conversations and respect each other. And I wish that we could do that nationally. And if forcing somebody to participate in a medical procedure as a provider that they believe is murder does not make any sense to me. We need to welcome diversity in this country. We need to respect diversity. And we need to respect each other when we have different opinions and not force our opinions on other people.
Yeah, thank you for that.
It really is fundamental to what you believe. How do you live with that? How do
President
you
Trump-
address those issues as you're moving forward?
You want me to
knowing
answer
that
the
it's going to
question,
harm
Senator?
Americans. Yeah.
You want me to answer the question?
No, I'm asking you.
Okay. President Trump has asked me to end the chronic disease epidemic and make America healthy again. And I'm
So
in a
is that
unique
the only reason
position.
why you're at HHS? Is that the
Excuse
only
me.
reason why then you're at the HHS to address that one issue?
President Trump has asked me, because I'm in a unique position, to end that. And that is what I'm doing. And if we don't solve that problem, Senator, all of the other disputes we have about who's paying, and whether it's insurance companies, whether it's providers, whether it's HMOs, whether it's patients or families, all of those are moving deck chairs around on the Titanic. Our ship is sinking. Our 60% increase in Medicaid over the past 4 years is the biggest budget line now, and it's growing faster than any other. And no other nation in the world has what we have here. No other nation has a chronic disease. We have the highest chronic disease burden of any country in the world. We had, during COVID, we had 16% of the COVID deaths in a country. We only have 4.2% of the world's population. We had a higher death count than any country in the world. And when CDC was asked why, they said it's because Americans are the sickest people on earth. The average person who died from COVID, American, had 3.8 chronic diseases. This is an existential threat economically, to our military, to our health, to our sense of well-being. And it is a priority for President Trump. And that's why he asked me to run the agency. And if I'm privileged to be confirmed, that's exactly what I'll do. A Cleveland clinic has developed an AI nurse that you cannot distinguish from a human being, that has diagnostics as good as any doctor. And we can provide concierge care to every American in this country, even those, the remote parts of Wyoming, Montana, Alaska, et cetera. We also have opportunities at HRSA and at the GME to finally live up to GME's mission of providing personnel to rural hospitals. And I intend to use all of my power, because I've seen the priority that is given by both Democrats and Republicans on this committee. I intend to make that a priority of if I'm privileged to be confirmed.
These requests from Congress, and will you make HHS transparent?
Yeah, my approach to HHS, as I said before, Senator, is radical transparency. Democrats and Republicans ought to be able to come in and get information that was generated at taxpayer expense, that is owned by the American taxpayer. They shouldn't get redacted documents. Public health agencies should be transparent. And if we want Americans to restore trust in the public health agencies, we need transparency. I want to say something about what you first said. When I launched my campaign, it was about uniting Americans, Democrats and Republicans. There's no issue that should unite us more than this chronic health epidemic. There's no such thing as Republican children or Democratic children. These are our kids. 66% of them are damaged. I know what a healthy kid looks like, because I had so many of them in my family. I didn't know anybody with a food allergy growing up, peanut allergy. Why do 5 of my kids have allergies? Why are we seeing these explosions in diabetes, rheumatoid arthritis, neurological diseases, depression, all of these things that are related to toxics in the environment? Why can't we just agree with each other to put differences about so many issues, intractable issues aside, and say, we're going to end this? I don't think anybody is going to be able to do this like I have, because of my peculiar experience, because I've litigated against these agencies. When you litigate against them, you get a PhD in corporate capture and how to unravel it. I've written 6 books about these agencies. I know a lot about them, and I know how to fix it. And there's nobody who will fix it the way that I do, because I'm not scared of vested interests. I don't care. I'm not here because I want a position or a job. I have a very good life and a happy family. This is something I don't need. I want to do this because we're going to fix it.
Clean up corruption and conflicts. Sounds great. You've said that you will, quote, slam shut the revolving door between government agencies and the companies they regulate. That also sounds great. So here's an easy question. Will you commit that when you leave this job, you will not accept compensation from a drug company, a medical device company, a hospital system, or a health insurer for at least 4 years, including as a lobbyist or a board member?
Can you just repeat the last part of the question? Can I commit
You're
to
not
what?
going to take money from drug companies in any way, shape, or form.
Who? Me?
Yes, you.
Oh, yeah, I'm
You're the
happy
one-
to commit to that.
Okay, good. That's what I figured. I said it's an easy question to start with. And I think you're right on this
I don't
question.
think any of them want to give me money, by the way.
Right.
I got a real quick question for you. Are you a conspiracy theorist?
That is a pejorative, Senator, that's applied to me, mainly to keep me from asking difficult questions of powerful interests. I was told that I was a conspiracy theorist. That label was applied to me because I said that the vaccines, the COVID vaccine, didn't prevent transmission and it wouldn't prevent infection, when the government was telling people, Americans, that it would. I was saying that because I was looking at the monkey studies in May of 2020. I was called a conspiracy. Now everybody admits it. I was called a conspiracy theorist because I said red dye caused cancer. And now FDA has acknowledged that and banned it.